All right, so this is going to be an update video about my dorsal slit surgery. So I want to say that first, as far as healing goes, everything has healed fine. The skin, when it's swollen and look crazy, like you like, oh shit, what the fuck did I just do? All that calms down and you're good. The skin will get how it used to be before. And pretty much throughout the day, you're going to just have like a little slit. If you have erections, it's going to open up more to where it's almost like cupping it almost. And when you're erect, the skin's gonna be back as if you were circumcised. So you don't have to worry about the pain from sexual experiences since the surgery. Basically, yeah, no pain. I still have like the mental thought of like, oh, it's gonna hurt, but everything has been fine. For my girlfriend, everything was fine for her as well. So overall, the surgery has been great in that sense. The tough parts is going to be when you're healing, and then you wake up in the morning from like erections at night and things like that, and you got to put on your you're wearing your clothes. It's going to be uncomfortable, maybe uncomfortable to sleep, but like now your head touching things it's never touched. And it just takes a while to get used to. I'm not used to it yet, so maybe you'll be sooner than me, but I'm not. As far as like the skin stretching and all that, yeah, I've had questions about that, but everything seems normal to me. It's like you have the slit and it goes down fine, no pain. It can go back up, fine. When you're erect, the skin it goes down. So you don't have to worry about pain there. It kind of looks almost as how it would look flaccid when the skin goes down, so that's fine. And then I mentioned healing. So I feel like overall, how it looks, people might say, oh, don't get it, it looks terrible. But honestly, I don't think, that's going to be the reason why any female or whoever you deal with is gonna stop you, because it doesn't look bad or anything like that. It looks all right. At first, it looks kind of crazy when you first get it. Initially, it's like, oh no, what did I just sign up for? I shouldn't have did this, whatever. But after that, it heals fine, and I think it's a great surgery. If you want to keep the look of your foreskin, like when it's flaccid, it's gonna still look like you have your foreskin. You're not, because you really do. You're just missing one part. But after you get it, it's gonna look like they cut off a whole lot of foreskin. But really, I assume it's not that much, just based off how it looks now. And so they cut it down until it's like at the head of the penis and then back up. I don't know how wide or whatever, but that's pretty much what it looks like. And it's fine. Everything's been healing fine. Do not rush to have sex. That's what I did. And it kind of pushed me back in my healing, which is why I kind of delayed making a video, because I wanted to know how it's going to be like to have sex and things like that. And I really feel like I can't say as much now, because right now I'm just using condoms to make sure that the injury or the problem that I had doesn't open up no more. And it's basically all healed up because the body heals itself, so it's not that big of a deal. But I feel like the next video I make, which will probably be in a couple more weeks to a month, or whenever, really when I feel like I know to say more about the sexual aspects, because I know that's what most people care about. And also, like I said, if you want to keep that foreskin look, this is the way to do it, but your head is going to lose sensitivity, because during the healing, your head's going to be out, and you can't stop that. That's just part of it. Your skin's going to be so swollen that it won't, go around the head until it kind of thins itself out. But overall, I'm happy with the surgery. I would recommend it if you want to keep that foreskin look. If you're worried about sensitivity loss, that's going to happen. But I feel like now it's able to take more than before. So before, if anything touched it, I was jumping. I was like, oh no. But now I feel like I'm able to manage myself better, and I feel like it's easier for, my girlfriend to deal with, or whoever, so that they don't have to be worried about, oh, it's going to hurt me and things like that. So overall, I like the surgery. I would recommend it if you want to keep that foreskin look. I wouldn't worry about people saying it's going to look crazy and all that. That's only when it's healing. But when it's healed, it basically looks like you just got, you took a scissors and just cut your like a little a little you know, a little opening in your foreskin. And it's fine. I'd recommend it, and thank you. And I should make an update video soon once I feel like I'm comfortable saying more, so I actually say something informational in my video.